Around half the adult patients at Covenant have COVID-19.
Could you give me, like, number-wise, any idea roughly how many that would be? Are we talking
Yeah, rather
100 or?
Yeah, I mean it's in the hundreds. It's a fluctuating number. It's a significant increase. To put it in perspective, we had at our peak in the spring about 25% of our inpatient beds were taken with COVID patients. So close to more than doubling since the initial peak in the spring.
Keep in mind, spring's situation was so rough it affected who received priority care.
Back in the spring, we were forced to stop caring for the non-COVID population. That had a serious deleterious effect on the health of our patients. Once we started doing those elective things again, people were sicker when they came back in. And so we're trying everything we can to avoid that.
Chief Medical Officer Dr. Michael Sullivan says the hospital has had to get creative, enacting surge plans and converting and opening separate units. Dr. Sullivan is hopeful the latest shutdown order will limit the spread of the virus, but it'll take time.
Hopefully that will decrease the number of patients that come to the hospital. You know, we're not going to see that right away. It's not like all of a sudden tomorrow there's not going to be spread of COVID. You know, the disease has an incubation time up to 2 weeks. And so I think it's going to take several weeks probably before we start to see a decrease.
Scott Walchek, WNEM TV5.